So I'm an embryologist and I work for my IVF clinic in North Lakes in Brisbane. So we are a fertility clinic that offers low-cost treatment options for patients requiring IVF. And we're also affiliated with the larger Monash IVF group, so they are well known for being world leaders in the field of fertility. So as an embryologist, we are required to help with what we call assisted reproductive technologies or ART procedures. So in a very broad sense, from a lab perspective, the two things we need is the egg from the female and the sperm from the male. So what we do is we prepare those two things, put them together essentially, and then monitor the growth and development of those embryos throughout the course of the week, and then hopefully transfer them back to the patient and result in a healthy and successful pregnancy. So there are very technical aspects of that role, of course, but other than that, we're also required to provide good customer service as well to our patients. So it can be quite difficult delivering some bad news to patients, but it's the good news that makes it all worthwhile as well. So a typical day in the lab will also start with what we call daily quality control checks. So essentially that's where we walk into the lab, turn on all the equipment, and for example, we make sure that it's all at the correct temperature. So the point of that is we are trying to mimic what happens in the conditions of the human body. So that's why those daily quality control checks are so important, and every procedure or task that we do throughout the day is monitored in that way. So that's how every day starts in the lab. And then from there, you can be assigned various tasks. So it could be the day where we're doing what we call oocyte pickup retrievals in theatre. And so that's where the doctor is collecting those eggs from the female patient. Now the role of the scientist there is to stand in the corner and look through that fluid that they're draining from the ovaries and search for those eggs. And once we find them, we put them into tubes and take them to the lab. So that's the role of the scientist in theatre there. Or you could be assigned on the other side, and that's where we prepare the sperm sample. And essentially what that means is we take the sperm sample and we put it in a tube, and then we put some media layer on the top of that sperm sample, and we let the best swimmers swim to the top of the tube and take that and recover that, and that's what we use for the insemination. So if you are the scientist doing the inseminations later in the day, there are two methods. So we have the standard insemination method, and that's where we take a large concentration of sperm and we put them in the same drop as the egg, and we let the sperm swim towards the egg and hopefully fertilise. And now the other method, which you may have seen in the media, is what we call intracytoplasmic sperm injection, or ICSI, and that's where we take a single sperm and inject it into the centre of the egg. So you could be the scientist doing that as well. So those are big clinic days for us, and then on the other days what we do is we see if those eggs fertilise the next day, and then throughout the week we are looking at the growth and development of those embryos and assess whether they're developing on time or not. Now good quality embryos can be transferred back to the patient, or they can also be frozen to be used at a later time. So you may be the scientist who's doing the embryo transfer, and that's where we load the embryo into a little catheter, and the doctor transfers it back to the patient, or you could be the scientist freezing those embryos as well. So it is really quite varied, and everything in between. We're giving the patients updates on their embryos, so that can either be done over the phone or face-to-face as well. One of the things I like most about my job is how much interaction I get with the patients, but also my colleagues as well. So from a young age I was also really passionate about science, and I knew that I wanted to work in the field, but I'm also quite a social person, and I feel like being an embryologist is a good balance of both. So I was always worried that I'd fall into a job where I'd be looking down a microscope and not being able to talk to anyone. So being an embryologist, we are required to collaborate with the clinicians and the nurses and the scientists, both within our clinic and other clinics as well, and the administration staff, for example, to give our patients the best outcomes. So I'd say that's what I like most about my job. So to perform the technical aspects of my role, you do require fine motor skills, and a lot of those skills are developed over time. So when we graduate from university, usually we come into a trainee position, and a lot of that developing those fine motor skills are on the job training as well. And then to deliver that complex scientific information to a patient in ways that they're going to understand, you also need to be a good communicator, so that's a skill that you need to have. And as I've touched on before, it's also good to be a good team player, and that will help you collaborate with all the other team members as well. One of the most challenging aspects of my role for me personally would be when the patients have unexplained infertility issues. So as a scientist, we're always wanting to know the answer, and we're wanting to know why things work and how things work. And as from a patient's perspective, they're also wanting to know why they're not conceiving naturally. So sometimes when we get poor fertilisation results, or the embryos don't make it to transfer, or they do make it to transfer stage but it doesn't implant and result in a successful pregnancy, but it looked like a textbook embryo, we don't always have the reason why. And that's something that I find challenging personally, to take that on board and step back and say, it's such a new field, we don't always know the cause of these problems, but it's also hard delivering that news to patients as well, because they always want an answer. So from high school, I went into university and completed my undergraduate and postgraduate qualifications. And then after university, I applied for trainee positions, and that's where I found my role at my IVF as a trainee embryologist, just working 3 days a week. And then fast forward 18 months to now, and I'm fully trained in what we have to offer at my IVF, and I work on a full-time basis now. So from high school, I'd always had an interest in science, but to be completely honest with you, I didn't know for sure where that would take me, and I think at a young age that's something that a lot of us struggle with. So that's in fact why I chose to study what I did at Griffith University, because it gave me a broad exposure, I guess, to biomedical and clinical sciences as well. So throughout the degree we did touch on reproductive biology, and that's where my interest for embryology kind of sparked. I did have other ideas. I wasn't sure whether I wanted to go down the clinical pathway or the research pathway as well, so there was a lot of ideas there. We also had a health law and ethics module, which I'm not sure if you still offer here, but that was extremely interesting to me. It did touch on the ethical problems surrounding infertility and IVF as well, so that was really interesting. I completed a Bachelor of Biomedical Science at Griffith University on the Gold Coast as my undergraduate degree, so I completed that in 2013. And then I also went on to complete a graduate diploma in reproductive sciences at Monash University in Melbourne. So from there, then a lot of the necessary skills that we need for the job were on the job training, and that took approximately about an additional 18 months. So my undergraduate degree took 3 years at Griffith, and then from there I took a year off just to really reflect on what I'd learned and how I wanted to apply that in the real world setting. So I took a few months of travelling and working just to get what they call that real life experience, and that's when I made the decision and committed to the postgraduate qualifications. So throughout my postgraduate year, we did have the course conveners that encouraged us to apply for trainee positions all throughout the year, and if anything it was for the experience of writing those job applications and interviewing as well. So based in Melbourne, I was applying for jobs all around Australia, and I was fortunate to have an interview, my first interview with my IVF clinic in North Lakes in Brisbane, and so I was fortunate enough to get the first job that I interviewed for, so it just goes to show that sometimes you just need the foot in the door to get the job as well. So the job that I was initially interviewed for was advertised as a part-time, fully qualified embryologist position, and being a part-time position only 3 days a week, I think that put some people off. They weren't as willing to move cities or states, but since Gold Coast and Brisbane was home for me, I didn't find that a difficult decision to make at all. So the other aspect being that they wanted a fully qualified embryologist, I took that and I took it to the interview and I said, I know that I don't have those technical skills already developed, but you can really mould me the way that you want me to learn. And so they took that and they did invest a lot of time and effort into training me the way that they wanted to. And it only took 6 months for me to transition from that part-time role into a full-time position, and an additional 12 months from there to become fully qualified after on-the-job training. I would have really just liked to have known what a typical day as an embryologist looks like. So having never met a fellow embryologist before, sometimes we really just go off what the media tells us essentially. So that's why I would encourage all the students to build on their networking skills as well, and if anything to find a mentor as well that can give you an insight into what happens on a day-to-day basis. So I guess my best piece of advice for students wanting to get into embryology or any other health-related degree is just to get some exposure to the field. So whether that's work experience or just purely observational, sometimes it's the networks that you make is more important than the job skills that you graduate with. So that would be my best piece of advice.